So I see and understand your passion for oncology, and you've mentioned sometimes it's a journey and it gets very dark sometimes. So how do you manage to balance between work and carrying that burden and walking the journey with your patients, and now going home, you have to be happy, you have to be at home? How's that balance for you?
It's very interesting. I don't think I have the magical answer now. Maybe I will find it.
Yeah.
But I try to do what I can. Before I even get to, I call it now life-work balance, because life comes before work. But even in between consultations, there's also a lot of emotional regulation that you need to. So a patient can be inside here, you deliver bad news in the best way you can. They cry, they come out of the door with tissues. The next patient who walks in, you're supposed to reset. You can't now transfer the sadness of the previous patient. This other one doesn't care about the one who's left here crying. So you have to shape up your face and be like, hi, Mama Nani, how is this? So that is also very difficult. But coming to what you said, now when you go home, you have to have an outlet. So my wife is also a doctor. She's a kidney specialist. So we talk a lot. She's my pillow. And also I am her pillow, because she also comes home with a different kind of drama from kidney patients. So talking is good. Talking to colleagues, to friends about your experiences is good. Remove that burden from you. Physical activity. So I do a lot of aerobics, HIIT exercises, general cardio, just spending time in the gym, and also talking inside there with people. It helps a lot. Recently, I started mixing using a DJ set. I have a passion also for music, so that also helps. And then just having regular breaks. So the good thing with oncology is we also get to travel a lot. So we have a lot of breaks within the year where we are going to Zambia for a conference. We are going to, and I can travel. I can have 12 international trips in a year, and it's all. I'm in Tanzania doing this. I'm in Abuja. I've done this. I go to Europe like 2-3 times a year. Sometimes you go to the US. So that cuts you off and gives you time out of work to just reset.
True. And I believe now you're even better.
Yeah, when you come back, you're re-energized, you're everything and so on. So you have to, and that has to be intentional. If you don't know how to do it, if you don't know how to say, this weekend, I'm not working. So-and-so is covering me. You go to Nanyuki and do something and come back.
Okay, that's good pointers. And he's briefly mentioned something about DJing, so we'll get back to that. We'll get back to the DJing bit in a moment. So I think the next thing that we're going to look at is, do you have a case or a patient whose story really stuck with you? One of those who was transforming for your career.
I'll have to think through it. Obviously, there are many cases at different points in my career. Some make you wiser and stronger. Others take you down and set you back a couple of spaces, because you can't heal everybody and you can't make every person happy. some people will be happy with you, but some people will be unhappy or dissatisfied with how they were taken care of, which is just the norms of life.
Yes.
But there's this particular patient, and she knows I tell her story a lot. It's not even a secret. Probably she will see this podcast. But her journey made me intentionally even want to subspecialize further. So now I treat most cancers, but 80% of my work time, both in public hospital and private hospital, is dealing with gastrointestinal cancers. And it was partly inspired by the story of this young girl. Back in 2020, she got diagnosed with liver cancer. And you remember that time we were landlocked. No planes leaving, no people coming.
Yes.
You couldn't go to India, you couldn't go anywhere. We had to deal with what we had here.
Yeah, sure.
Lockdowns were real.
Yeah.
Masks, everything. So not only COVID is stressing you, but you have a very stressful diagnosis.
Yeah.
It was pretty advanced. She went through several treatments, including surgery. And for the first 6 months, things were not looking good for her. And we doctors, we know, and we can tell when
things are not looking good.
the one has been hit by things. I don't want to say bad words on a podcast.
We get it, yeah.
So it forced me, and I think this goes back to challenge yourself. So I had to dig into medical knowledge to see what can we do to help her. And we ended up getting a very innovative solution, and she was successfully treated with immunotherapy. And her very advanced liver cancer went into remission. I think we're almost in the 3rd year now. So she came back from a situation which is rather difficult for many to come back from. And we recently actually celebrated her Thanksgiving in, I think it was one of the churches in Lavington. And I actually went because I was invited to give a speech. So she's now 35. She was 30 when we met.
That's quite young.
Yeah, so her story, it lives in me. And every time I feel like, hey, this day has been hard, I remember the good outcome that we had from her story.
Yeah.
And then it pushes me to go forward. I mean, she's not the only case of a good outcome. I have many cases of people who you could easily think their time to exit was near, but they live, walk, talk, breathe, go to work, go to church, take their grandkids to whatever. They have a full, vibrant life.
So I think of late, even in the news, there's been an increase in cases of cancer. And would you like to comment on that?
Okay, so very good question. Do we know all the answers? No, but we know some. One, the population of the country is increasing. So naturally, its problems will increase. So the same way cases of heart failure are increasing, diabetes increasing, same.
Yeah.
Two, lifestyle. We are sedentary, meaning we are not physically as active as we were before, and we are not eating healthy food. Every 2 steps, KFC, I don't know what.
Yeah.
Apartments everywhere. We can't walk. We can't expend energy. A place where you could walk. Someone is Ubering from here, 200 meters away. You're still taking an Uber. So you gain weight, you become overweight, you become obese, then you get cancer. Number 3, which I think is very important, is we now have the ability to diagnose cancer better and faster. Previously, people would die before they get to the CT scan. Alienda juu hatujui, or alirogwa, or it was tuberculosis or some strange illness, which was given another name because of the intense stigma, fear and ignorance towards cancer. So they were never counted. But now every small town, there's CT scan, ultrasound, so you can get the diagnosis. So the numbers will rise up. And then obviously there are many unanswered questions about what is in our foods. There's all this talk about
pesticides.
What people are using to make that banana stay yellow for 2 weeks. To make that orange stay orange for 2 weeks. What preservatives are there? So a mix of many things, and it's just getting worse.
Okay. So does it feel like, is there something we can do to, minimize the cases?
To reverse that will take time. It will take maybe 2-3 decades before we start seeing the numbers to start to go down again, because we need to change a lot of things, and things are already changing. Tobacco policies are in place in many countries now, so smoking rates are going to go down, vaccination rates will go up, liver and cervical cancers will go down, more screening, might find more cancers, but maybe we'll treat them earlier and improve survival. But if the population just keeps growing and growing and growing, the cases will just keep growing and growing and growing. But we really need to check, especially what we eat, manage our lifestyle, manage our abuse of alcohol and tobacco. Maybe we'll see a small change. I don't think it will be a very big one.
Okay. At least there's something that you can do to lower your chances of getting cancer. Alcohol, smoking, exercise.
Keep a low weight and a BMI. Go for screening. If you hear somebody is doing screening somewhere, go for screening. Eat healthy, exercise. Just being thin, being thin is not being healthy. No. You have to expend physical. That lowers a lot of, let me call them, bad chemicals in the body. When you exercise, those bad chemicals that cause stress to your body cells and then trigger, mutations and trigger these cancers. It's just because half the time we're just sitting and doing nothing, it's sadly where society has gotten us. But I'm happy to see that people are beginning to realize that you can't just sit at home scrolling in your phone morning to evening. So people are going out there hiking, biking, and doing all sorts of physical things. So I'm happy to see at least the youth taking that angle, which is good.
Healthier living, I believe. All right. So I think now that you've spoken about that there's that aspect of there's some myths that people assume that if I do this or I don't do this, I will probably get cancer. For example, let me put it in context. So a patient might come and get screened, and there's this mass that is identified or seen in their body, and they need a biopsy, I believe, to go and test if it's cancerous or something. So some people are afraid to go for that procedure because they feel if you interfere with that mass, it will just spread to the rest of my body. So can you maybe explain, if someone goes for screening and there's something detected, how do they go about it? What should they be concerned about? Are those real fears that might give you cancer?
It's okay to be afraid because it's a human feeling. Everybody is scared of cancer, including myself. I'm not, just because I'm on the other side doesn't mean I'm not afraid of it. But the truth is, majority of us fear cancer because it's closely associated to death or dying. If cancer was not a disease that kills, people would be, and everybody would be going for screening because they know. It's easier to tell somebody, let's check if you have diabetes. If you have it, fine, just start taking medicine and you're fine, because it's not immediately associated with a bad outcome. So obviously, if anything is pointing in that direction, it brings fear, uncertainty. Previously, trying to cut out the specimens could, in theory, make the cells spread, but now we have better and more finer ways of taking biopsies that minimizes that chance of spread to zero. So it's safe to do a biopsy because that's the only way we'll know what the problem is and address it in the fastest way possible. So just speaking with your doctor and understanding what is your real situation can help you make an informed decision.